Are imperfect vision, contact lenses, and glasses frustrating you? Are you looking for some relief? The right laser eye care professional can really help, and finding the right specialist is key. Today we're meeting up with a local expert of laser eye surgery who will walk you through finding the right fit for your newfound vision.
A common question that I get asked is how I can help people with their reading vision when they get into their 40s. The problem is that the natural lens loses its flexibility as they get older, and they can't change the shape of the lens to help them focus on near objects and distance objects, and that's called loss of accommodation, and when that happens in your 40s it's called presbyopia. So, for instance, I had a patient 2 weeks ago who was 48 and works as a company executive who was finding it difficult to see the computer screen and juggle between needing reading glasses and then having to put them down to see into the distance again. He was also misplacing his reading glasses fairly frequently, and in a case like that, the solutions we discussed for him were two options. One was the possibility of laser surgery, where I would perform a procedure called monovision, and that's where one eye is fully corrected for distance, usually the dominant eye, and the other eye is left in a little short-sighted to give a patient near vision. It sounds strange, but the brain actually works together with both eyes to use the eye that's clearest for whatever distance you're looking at. The other option would have been to perform lens exchange surgery and use a sophisticated multifocal lens to give the patient good distance and near vision. The advantage of lens surgery is that the patient can't go on to get cataracts as they get older because they don't have a natural lens any longer. In my experience, however, patients who are below 50 do extremely well with laser monovision, particularly if they're short-sighted to start with. Long-sighted patients do better with lens exchange surgery. In this case, the gentleman had laser monovision surgery and is delighted with the result. He's able to read without the need for glasses and see well for distance, and he doesn't have that annoying need for finding reading glasses every time he wanted to read a document or look at the computer. If somebody wanted to know what procedure was best for them and who they should trust to look after their eyes, I would have to say that different solutions work for different prescriptions at different ages. There's really no one treatment as the optimum solution for everybody, and each patient should have a bespoke treatment that suits them, their lifestyle, their age, and the condition of their eyes and their glasses prescription. It's very important that they ask their surgeon what range of different surgical procedures that they personally perform, and really how many of these that they do. Ideally, their surgeon should be performing both laser and lens surgery every week to offer the right solution for their eyes. Another critical question is that they should ask the person that they see whether they will actually be performing their surgery, and also see them at their follow-up and be completely responsible for their care. It's quite common for clinics to employ other members of staff that see you, and you may only see your surgeon on the day of your surgery, which I think is unacceptable in terms of duty of care and responsibility for you. It's also useful to look for recommendations from other patients and reviews of their experience with the surgeon and clinic. Now, if somebody wanted to get in touch with me, they could arrange to see me at Moorfields Private, which is part of Moorfields Eye Hospital in London, and they can simply call my secretary on 0207 521 4641.
Incredible! What a huge impact a little time can make. With the right eye care professional, the focus is simple. Ready to learn more? You can reach today's expert by calling the number on your screen. See you next time!